Well, the use of telemedicine has exploded during the pandemic, but a new device is taking online office visits to the next level. Doctors can now program a device inside the patient's brain while the patient is at home. IU Health Neurology is one of only a few programs in the country selected to be part of the device's early market release. Business of Health reporter Kylie Valletta has more. Kylie?
Thank you, Gary. Illinois-based medical device manufacturer Abbott chose IU Health to be one of just a handful of programs in the U.S. to pilot its new deep brain stimulator. Called NeuroSphere Digital Care, the device and its coinciding app allow a doctor to use the cloud to connect to the device inside the patient's brain without the patient leaving home. A handful of Hoosiers are already using the technology, and IU Health expects that number to grow. Joining me now to tell us more about this major advancement in telemedicine is IU Health neurologist Dr. Elizabeth Zauber. Thank you so much for being on the show today.
Hi.
All right, well, before we talk about this new device, let's start first with an introduction to deep brain stimulators in general. They've been around about 20 years now, and it all starts with a surgical procedure.
That's right, yeah. So deep brain stimulation surgery, we also call it DBS for short, is a neurosurgical procedure. It's used to treat a variety of brain disorders, most commonly essential tremor and Parkinson's disease. And what's involved is that it delivers electrical impulses into the brain, and that can help to significantly reduce the tremors in someone with essential tremor, or to control other involuntary movements in people with Parkinson's disease. As you said, it's been around for a while, it's well established, and it can have a really big impact on patients' quality of life.
All right, so let's talk about this new deep brain stimulator from Abbott. It really takes telemedicine to the next level. What does this new device now allow you to do?
Yeah, so after the neurosurgeon places this device, there's a process of tuning the electricity. And that's something that me and my team do. And that typically requires a long time of patients coming into the office and having it adjusted until we get the settings optimized. So that typically would require a lot of in-office visits. This new update will allow patients who have Abbott DBS to receive those types of visits in their home. And allow them to not have to make as many frequent trips to Indianapolis. And this is a big advance. It's never been done with DBS, and it's never been done with any particular type of implanted device before.
And you mentioned this really will make it easier for patients who live, outside of Indianapolis. They won't have to make so many trips to come in.
That's right. Because we are a large academic center here in Indianapolis at IU Health and IU School of Medicine, we do draw patients from all four corners of the state, and many patients have to drive several hours to get here. And so being able to have some of their visits performed at home will be a big benefit for them.
And IU Health was among just a handful of programs throughout the U.S. selected to be part of this early market release. What do you think that says about IU Health's neurology program?
Yeah, so this type of treatment requires a really coordinated approach between neurology, neurosurgery, anesthesia, nurses, our industry partners, and it's a high-level specialized treatment that we think we provide a really good high quality of care, and I think this reflects that, as well as a large volume of patients that we treat over a large geographic area.
So
it's also, go ahead.
Oh, you go ahead.
I was just going to say it's also a sign that we are seen as leaders in this particular area and helping to move technology forward.
As we all know, the use of telemedicine has certainly exploded during the pandemic. Do you think that really helped open the door to this device?
Certainly. One advantage is that this doesn't require a new implant for these patients. If patients already have an Abbott DBS, they can just get a software update. But I think the software update was likely able to occur much more quickly because of the explosion of telemedicine that's occurred during the COVID-19 pandemic. Not only have physicians become more comfortable treating patients remotely, but patients have gotten much more used to using telemedicine to access care. And so it's definitely opened the door for this type of advance.
And this is really a niche device right now. Just a few seconds left. About how many Hoosiers are using it now, and kind of what do you expect to happen to that number?
I'd say, yes, probably a handful of patients currently have this device and can access these types of visits. But since we're a center that implants about 70 or so DBS per year, we could certainly see that number grow quite a bit in coming years.
All right. Well, Dr. Zauber, it's an absolutely fascinating technology. Thanks for being on the show today to share a little bit more about it.
Thanks for having me.
And Gary, back to you.